say Cornerstone VNA is a leader in our industry of home health, hospice, and palliative care services because of, number one, the fact that we are independent and that we're a nonprofit. We are able to take our community needs, what are our needs of our patients, our community members, and make change, and we get that done. There's two areas that I want to talk about, and one would be our commitment to staff education. And that's one of the things that helps with longevity, is you educate your staff, you get them passionate about your work, you get them knowledgeable about their work, and you engage them in all the aspects of it. They are much more satisfied. And then they help us train other nurses, other therapists, other LNAs that coming on board. Education really is number one, in that keeps your staff and it improves your patient care. One of the things about the visiting nurses, we've been around a long time. For Cornerstone VNA, it's been over 100 years. And caring for the people in the home is much different than the healthcare that you may receive elsewhere. When I started in home health care, the length of stay in the hospital was quite long. You were cared for in the hospital and you went home with some minimal services. That has changed significantly over the years. So the importance of the visiting nurses is to have that level of skill set to care for some of the most acute patients. Our staff have been taking care of COVID-19 patients in the home. They are patients that were in the hospital and now recovering at home. We have been able to do this not only with the nursing visits and therapy visits and nurses' aid visits, but also with telehealth. We have a telehealth monitoring system that we invested in a few years ago, and we have a telehealth nurse that's in the office, and each patient gets a monitor. So they actually can get daily visits from the nurse, making sure their O2 sats are okay. So that's their breathing, and that's critical with COVID-19. Are they breathing okay? Do they need oxygen? Are they taking their medications? Are their vital signs stable? How is their weight? What is their temperature? We do that daily monitoring. That way we can minimize those visits into the home, because some of the people in their home, some of our patients, were nervous about having people come into their home. So we wanted to try to balance that. So New Hampshire is one of the oldest states in the U.S. with the largest population of seniors. And we have been predicting this, and we are faced now with a significant nursing shortage. It's really difficult to hire nurses. I've been on committees that have worked with our legislators on coming up with ideas how to improve the nursing shortage, but we are going to be in a crisis. So we really have to work together as a state to address this situation. I'm inspired every day by the work that we do. Taking care of patients, letting them age in place. And it's not just seniors that we take care of. We take care of newborns. We are the only organization in our area that care for children on hospice services. That's a very difficult thing to do. And I'm so proud of our clinicians that have been able to step up, get the education they need and the support that they need to be able to do that. So all aspects of the work that we do, I'm inspired every day.